Assalamu alaikum. Shock. What is shock? Shock is defined as a complete life-threatening condition or syndrome characterized by inadequate blood flow to the tissue and cells of the body. Types of shock. Number first, hypovolemic shock. Number second, cardiogenic shock. Number third, neurogenic shock. Number 4, septic shock. Number 5, anaphylactic shock. Cardiogenic shock. Cardiogenic shock is a serious condition that occurs when your heart cannot pump enough blood and oxygen to the brain, kidneys, and other vital organs. Cardiogenic shock is considered a medical emergency and should be treated immediately. The most common cause of cardiogenic shock is a heart attack. Causes में नंबर फर्स्ट किया है acute myocardial infarction resulting in massive damage to myocardium. Number second, CHF, pulmonary embolism. Number third, cardiac tamponade. Clinical features. Number first, same as hypovolemic shock, dysrhythmia, chest pain, respiratory distress, multi-organ dysfunction syndrome, and death or its complications. Number 6, left and right ventricular failure, mechanical complications including ventricular septal rupture. Neurogenic shock, inability of nervous system to control dilation of blood vessels. Neurogenic shock results from generalized vasodilation and loss of vasomotor tone due to massive increase in vascular capacity, pooling of blood in periphery, decrease venous return to heart. Causes: brain traumatic injury, brain damage, vasomotor depression, spinal cord injury, deep spinal anesthesia, severe pain, hypoglycemia, and emotional stress, drugs causing vasomotor center depression, anti-snake venom. Clinical features: nervousness, confusion, skin warm but dry, respiratory depression, and hypotension. Hypovolemic shock. It occurs when a significant amount of fluid is lost from the intravascular space. Fluid or may be blood, plasma, or electrolyte solution. It is the common type of shock. Causes of hypovolemic shock. Number first, severe bleeding, for example, ectopic pregnancy, uterus rupture, severe Foley trauma, hemopneumothorax, hematemesis, and hemoptysis. Number 2, severe persistent vomiting, severe diarrhea, severe edema, ascites, peritonitis or pancreatitis, and severe burns. Clinical features. Number first, hypotension, tachycardia, tachypnea, skin cold and clammy, pallor, anxiety, restlessness, and weakness.